Good morning, everybody. Thank you for coming to our program. My name is Dr. Kevin Pruitt, and I will be your moderator for today's event. I'm the chairman of the 7th District Medical Health Initiative Committee of Omega Psi Phi Fraternity Incorporated. Throughout the year, we usually distribute medical literature and conduct webinars on various medical conditions. My background is in medical research and minority health issues. Currently, I serve as the Chief Medical Science and Director for PBJ Medical Associates. The 7th District of Omega Psi Phi Fraternity and Global Health and Community Service Incorporated will present today's webinar on diabetes type 1 and 2. I do have to tell you this, the program will be recorded today. The views expressed today are those solely of the presenters and not the views and opinions of the 7th District of Omega Psi Phi Fraternity Incorporated and Global Health Community Service Incorporated. In making any medical decision, you should consult your personal medical physician. The 7th District of Omega Psi Phi Incorporated is committed to providing high-quality medical literature and webinars on various medical conditions throughout the public. We are the largest district in the fraternity, and we compose pretty much of 4 different regions and states, and that's Alabama, Florida, Georgia, and Mississippi. Our partners, Global Health Community Service Incorporated, is committed to conducting seminars, workshops, and structured events that educate and inform the public on health-related issues. We have 3 exciting speakers for you today, and we're sure you will be engaging and informative for your personal edification. If you have any questions, we ask that you type them in the chat box, and we will attempt to present them to our speakers. Next, let me introduce, I should say, Brother Reginald Harris, the 24th 7th District Representative of Omega Psi Phi Fraternity. One of Brother Harris's chief goals is the promotion of health initiatives and to provide information to the public for their safety and well-being. Brother Harris will bring the greeting to us at this time. Brother Harris, you have the floor.
Thank you so much, Brother Dr. Pruitt. Greetings and welcome to a life-changing webinar as we, the men of Omega Psi Phi Fraternity Incorporated, continue our efforts to uplift our community and enhance our quality of life. Again, I am Brother Reginald M. Harris, the current 7th District Representative, and it is with the blessings of the Supreme Basileus of the Universe, our Lord and Savior Jesus Christ, that we present to you what we hope will be a significant emotional experience. You know, it has been stated and proven, in order to make a lasting change, one must encounter or engage in a significant emotional experience. It is my fervent prayer and belief that those participating in this endeavor will be moved to such a change. Diabetes is the 5th leading cause of death among Black Americans, and it is rapidly growing in the destruction of the family unit. Fortunately, though, through education, medicine, and a sound nutrition plan, positive progress in reversing this trend can be gained. We believe that this webinar is the impetus for such a change. I'd like to thank Brothers Jeffrey Jones, Percy O. Pratt, along with Brother Dr. Kevin Pruitt and the entire team for their efforts in making a difference in the lives of others. Do enjoy yourselves, and with the knowledge gained from this webinar, seek to make a positive impact on someone's life. Thank you.
Thank you for those words, Brother DR, Brother Reginald Harris. Next, I would like to introduce Brother Percy L. Pratt, the President of Global Health and Community Service Incorporated. Brother Pratt is also a member of Omega Psi Phi Fraternity Incorporated, and Global Health has been instrumental in presenting several cutting-edge webinars from a variety of subjects, including COVID-19 vaccines and prostate cancer awareness. Brother Pratt will bring us a greeting at this time. Brother Pratt, you have the floor.
Thank you, Brother Pruitt. Greetings. I'm Purcell Pratt, the President of Global Health and Community Service, Inc. I'd like to take this opportunity by thanking for the partnership with the 7th District. The 7th District representative Brother Reginald Harris, and Brother Dr. Kevin Pruitt, and also Brother Sean Bland. Of the 7th district of this Omega Psi Phi Fraternity Incorporated, I'd like to thank you all for participating here today. Please enjoy the program, and thank you again. I am Purcell Pratt. Enjoy yourself and be safe.
Thank you for those words, Brother Pratt. I appreciate that. And we'll move on to our keynote speaker. Our first speaker today will be Dr. Tawanade Anyusada, the intern chief of endocrinology at Meharry Medical College at Nashville General Hospital. Dr. Awusanya is board certified by the American Board of Internal Medicine and Endocrinology. She will present causes, symptoms, and treatment options following our next guest, Shanique Thompson, who is Miss Grand Intercontinental Jamaica 2020 to 2021 from Kingston, Jamaica. She will bring us the welcome. Ms. Thompson, you have the floor.
Good afternoon, ladies and gentlemen. I am Shanique Thompson, the reigning Miss Intercontinental Jamaica. It is an honor to welcome you to this amazing event on diabetes awareness and management. There are over 34 million people living in the US with diabetes and over 88 million who are pre-diabetic. And diabetes affects our body in so many ways that we need to take steps that will keep our risk factors under control. Our speakers today, they will be providing us information on diabetes management and how we can control them. So I'll now hand over to the good doctor who will tell us more about diabetes health and management.
Greetings, everyone. Again, I'm Dr. Awusanya. I'm the division chair of endocrinology at Meharry Medical College and Nashville General Hospital here in Nashville, Tennessee. Thank you for allowing me to be part of your program today. It is a pleasure to be giving this ultra short talk on diabetes. As endocrinologists, diabetes is the most common disease we encounter in our clinical practice. And so by the end of this short talk, my hope is that we're all better informed on pre-diabetes, which is a precursor to diabetes, and the diabetes disease itself, and little steps we can take to keeping the disease itself at bay. Before I delve into talking fully about diabetes, it's important for me to spend a few seconds talking about sugar itself and pre-diabetes. Sugar is also known as glucose, and glucose is vital to life, as we know, because it serves as a source of energy for cells that make up muscles and tissues in our body. And as we all know, sugar or glucose is the main source of fuel for the brain. Switching over to pre-diabetes, pre-diabetes itself is a precursor to full-blown diabetes, meaning you're doing the dance before you cross over to full-blown diabetes. It is a period where your blood sugar is higher than normal, but not high enough for you to receive the diagnosis or label of being diabetic or having the diabetes disease. In the pre-diabetic stage, if it is well managed by your provider as well as yourself, both of you may be able to prevent crossing over to full-blown diabetes or making the pre-diabetes phase go into remission. Diabetes mellitus itself is a chronic disease. It is an inability of the body to adequately process sugar. When the body is unable to process sugar, this leads to elevated levels of sugar in the bloodstream and in other parts of the body, like our vital organs and tissues. This elevated blood sugar in the bloodstream is termed hyperglycemia. And so some of us that are diabetic would hear the provider talking about hyperglycemia. This just means persistent elevation of your blood sugar levels. And the key word is persistence, so that's why we say it's a chronic disease. It's been persistent for a while. When you have consistently high blood sugar levels in your bloodstream, this leads to deposition of the sugar molecules into the brain and heart vessels. So for example, if you have blood sugar molecules being deposited in the brain and in your heart and blood vessels, it increases your risks for a heart attack. It increases your risks for strokes. And in men, the blood vessels that supply the sex organ, it would increase your risks for erectile dysfunction. If you have elevated sugar levels in your kidneys, it increases your risk for kidney failure, and individuals that eventually end up having their kidneys shut down end up on dialysis for the rest of their lives. When you have sugar deposits in your eyes, it increases your risks for retinopathy, which pushes you further into the blind stage. There are several types of diabetes, but because our talk is very short, I streamlined it to the three most important causes of diabetes, or types and classes of diabetes, excuse me. We have type 1 diabetes, which is commoner and usually diagnosed in the young from age 0 to age 18. And so we find the type 1 diabetes disease itself is commoner in kids. We have type 2 diabetes, which is commoner in the older generation. And then we have gestational diabetes. Gestational diabetes means diabetes that is diagnosed during pregnancy from weeks 28 to weeks 32. And the gestational diabetes process itself is completed or resolves once the baby is born. But studies have shown that within 5 years of the diagnosis of gestational diabetes, more than 53% of women end up crossing over to full-blown diabetes. Other types of diabetes include maturity-onset diabetes, steroid-induced diabetes, and as we now know, COVID-induced diabetes. According to CDC, about 34.2 million Americans have full-blown diabetes, and that's 10% of the US population. 26 million are diagnosed, meaning they know that they're diabetic. Whether or not they're on medication is their choice, but they're fully aware of the diagnosis of diabetes in them. The remaining 7.3 million Americans have gone undiagnosed for two reasons. Their providers told them they were diabetic, and they don't believe they're diabetic, and so they're not taking any medication, or they forgot that they were diabetic and have some exclusively removed that diagnosis from part of the diseases that they have. And the other half of them have not been diagnosed in the sense that somewhere out there in some lab somewhere, it has been shown that they have elevated blood sugar levels, but they haven't been informed that they're diabetic. 88 million Americans age 18 and over have been diagnosed with prediabetes, and 24 million of them are 65 years and older. The underlying cause of diabetes differs by the type. Irrespective of the disease process, the common problem is high levels of sugar in the bloodstream. As we know, the pancreas, which is this tiny organ which sits behind the stomach, has two functions. It secretes gastric juices for digestion and also possesses cells that produce insulin. When the cells that produce insulin in the pancreas shut down, patients that have this issue at increased risks of progressing to full-blown diabetes. Type 1 diabetes, the cause of type 1 diabetes, is an autoimmune reaction whereby the body attacks itself. The body, we mean the pancreas, is being attacked by antibodies from the body in error. And so when the insulin cells that are found in the pancreas are destroyed completely, patients that have type 1 have no choice than to be started on insulin either via the syringe or via the insulin pump. Again, it's important for us to know that insulin is what regulates the amount of sugar or glucose in our bloodstream. And when the cells that produce insulin, which helps to regulate this sugar, are dead, the body is unable to produce insulin. And so to keep them stable and alive, the treatment for type 1 patients is administering insulin via injections and insulin pumps for them to survive. Type 2 diabetes is caused or occurs as a result of insulin resistance. That just means that the body doesn't use insulin or respond to the insulin that the pancreas is producing. Typically, you find this commonly in patients or individuals 30 years or older, and you find multiple people in the same family sharing the diagnosis. It develops over many years, but it can be prevented or delayed if you changed your lifestyle. The treatment of diabetes varies. You have oral medications and or insulin regimen. There's several risk factors for the development of diabetes. We've already talked about type 1, whereby the insulin cells are destroyed and you become type 1 and you're dependent on insulin the rest of your life. But these risk factors are particularly for type 2 diabetes individuals. If you have a strong family history of diabetes, for example, your mother had diabetes, or both parents have diabetes, or your maternal side, they're all diabetic, or your paternal side, they're all diabetic, or both maternal and paternal sides and some of your siblings are diabetic, it increases your risks for having diabetes as well. If you're overweight or obese, it increases your risks for diabetes. How? Because your abdominal fat, right, is termed adipose tissue. Fat anywhere in the body is termed adipose tissue. If you have increased adipose tissue, this causes or promotes insulin resistance, basically. So being overweight and obesity increases your risk factors for having type 2 diabetes. Of course, sedentary lifestyle or inactivity increases your risks for obesity, increasing your risk for diabetes. Diabetes is found to be commoner in the Hispanic population as well as the non-Hispanic African American population when compared to the Caucasian race. COVID-19 increases your risks for diabetes in the sense that it goes, the disease itself or the cells from the disease migrate into your pancreas, destroying the cells that produce insulin. That's one way it does it. The second way it does it is it goes into the cells and changes the mechanism of action or gives another command to the insulin producing cells. A history of chronic steroid use, either for back pain, during cancer treatment, increases your risks for type 2 diabetes as well. It's important for us to be able to identify the symptoms of diabetes or symptoms that would suggest that one has diabetes. The most common ones we term polyuria, polydipsia, which just means increased urination and increased thirst. Associated with these two is rapid weight loss without trying. And why do you have this rapid weight loss? Because when your bloodstream is overwhelmed with sugar, the kidney's job is to fix that situation by dumping sugar in the urine. Now, it's important for us to know that sugar is calorie. If you lose sugar, you're losing calories, therefore you're losing weight. When you lose sugar in your urine, because it's a concentrated state, the body expels water in addition to the sugar it's expelling. If you're losing water, you become dehydrated, right? You're losing water through the kidneys, so you're peeing a lot. You become dehydrated, you get thirsty. That's how we get the increased urination, the increased thirst, and the rapid weight loss without you trying. Other symptoms include blurry vision because of the high hyperglycemic state. A lot of my older patients talk about having Charlie horse in their limbs, which is numbness or tingling in their hands and feet. Some, because of the chronic inflammatory state, some struggle with fatigue. Some have poor wound healing, and a lot of my patients have recurrent yeast infection. It's important for us to know the ABCs of our health, especially when we're diabetic. If you're fully diabetic, it's important to adequately control your blood pressure, okay? As we all know, diabetes increases your risk for cardiovascular disease, which means increased risk for heart attack, increased risk for stroke, increased risk for erectile dysfunction. And so it's important to tightly control your blood pressure if you have hypertension in addition to diabetes. The goal for your blood pressure should be less than 130 in the systolic or top number, and less than 80 or less in the bottom number, okay? And your blood pressure should be checked at every visit and also once a week at home. Also, for your cholesterol, as you know, we have the good cholesterol, we have the bad cholesterol. Because cholesterol also increases your cardiovascular risk, guidelines have been given for the adequate numbers that determines your level of safety when you have high cholesterol. The bad cholesterol is termed LDL, and it should be less than 100. The good cholesterol is termed HDL, and it's expected to be greater than 40. Now let's go to the A1C. Letter A, number 1, letter C means glycated hemoglobin. What does that mean? Your red blood cells have sugar molecules attached to them at baseline. And so your A1C is a snapshot of your red blood cells with the sugar molecules attached to them over 3 months. So technically, it's an average of your blood sugar over 3 months. Per Medicare regulation, patients that have full-blown diabetes should have their A1Cs checked every 3 to 4 months. Patients that have pre-diabetes should have their A1Cs checked at least once or twice a year. If you have the diagnosis of diabetes, your A1C should be 6.5% or greater, as my next slide will explain. This just lets us know what to expect when we get the diagnosis of prediabetes and full-blown diabetes. If you're a normal individual, it's expected that your A1C should be less than 5.7%. If you get the diagnosis of prediabetes, your A1C is expected to be between 5.7 and 6.4%. And full-blown diabetes, your A1C is 6.5% or greater. What are the targets for your blood sugar as an individual with diabetes? Whether you have type 1, whether you have type 2, your goal blood sugar, fasting, those are the terms you hear. Your fasting and your before meal blood sugar should range between 80 and 130. The Endocrine Society recommends between 80 and 150 milligram per DL for your blood sugar. Your peak blood sugar after you eat, your blood sugar actually after you eat should be checked 2 hours postprandial, which just means after meal. And your peak blood sugar should be 180 or less, whether you're type 1 or whether you're type 2. This slide just shows us the different A1Cs, right? And the estimated average blood sugar. So I have a few patients coming to my clinic. They don't bring their blood sugar readings, they don't bring their glucometer, they don't bring their CGMs. And then they tell me, well, over the last 3 months, they've been taking their insulin and they've been checking their blood sugars regularly. And the blood sugars that they see the most ranges between 100 and 150. The only option I have at that point, because I don't have anything to guide my titration of their medications, is to check their A1C. If I check your A1C and your A1C is 12%, it means that your blood sugar has been averaging between 250 and 300 for the past 2 to 3 months. If I check your A1C and it's at 10%, it means you've been averaging 240 or greater over the past 3 months. So when I check these individuals' A1C, a lot of times it's high. And so it reveals to me what exactly is going on. Either they're not taking their medication, or they're taking the medication and their lifestyle modifications are wrong. And so the A1C is like the CIA. It confirms what you say, or it reveals the truth about what you're really doing at home. The current therapeutic strategy for treatment of type 1 diabetes include insulin injection, insulin administration via the injection, or the insulin pump. In some situations, patients are able to get the whole pancreas transplantation. It's like getting a second chance at life without diabetes. But insulin injection therapy is a treatment of choice for the majority of patients that have type 1 diabetes. For type 2 diabetes, we have more wiggle room, okay? we can use oral medications, and we can use insulin. This slide just shows us the different sites of action for the oral medications that are administered for patients that have type 2 diabetes. To improve insulin sensitivity, some medications like metformin act on the muscles, okay? A lot of patients with type 2 diabetes are on metformin if they can tolerate it. Some medications like Jardiance, a lot of patients are on Jardiance, and we see the commercial on TV as well. Jardiance increases the dumping of sugar into the kidneys and into your urine, okay? And so with Jardiance and medications that act like that, you get the benefit of blood sugar control and you get the benefit of weight loss as well. You've also heard of medications like Victoza, Trulicity. What they do is they go to the gut and they delay gastric emptying, meaning they delay your gut from emptying, basically. It slows the blood sugar release, and so those medications are able to slowly control your blood sugar. This medication here prevents breakdown of whatever starchy meal you eat and causes you to pass it out through the stool, okay? Some medications also increase insulin release from your pancreas. Those medications are termed sulfonylureas, aka glipizide, glimepiride, glyburide. I'm sure a lot of us have heard about those medications. This chart just provides examples of some, but not all medications used to treat diabetes. We've heard of Tresiba on TV. We've seen Farxiga, Jardiance, Victoza, Trulicity. The current research or therapeutic intervention for both type 1 and type 2 diabetes are the insulin pumps and the continuous glucose monitors. Gone are the days where you have to keep sticking your abdomen or your arm or your thigh with an injection with a syringe that contains insulin. Now we're able to use the insulin pump to administer insulin into the body. The pump is the size of the pager. I don't know if we all remember the pager. It's a really small device and can carry up to 300 units of insulin. And the insulin is transmitted into the bloodstream via a small tube, which is connected to the device and connected under the skin of the individual using the device. The second fantastic thing that has been created for management and control of diabetes is the continuous glucose monitor, which allows for minute-by-minute blood sugar readings without finger sticks. We have the Freestyle Libre device and we have the Dexcom series device as well. What are the complications of diabetes? I already stated that in my first slide from the get-go. When you have high sugar deposits in the eyes, you have increased risk of retinopathy, which leads to blindness, cataract, and glaucoma. If you have it in the kidney, it increases your risk for kidney failure and shutdown, and individuals end on dialysis. If you have the pain and numbness, tingling sensation, it increases your risk for not detecting injuries or wounds you have in your feet. When this goes undetected, it can lead to gangrene, and that's when you find that the bone is infected and patients go through amputation of those limbs just so that we can get adequate control of the disease. If you have deposits in your brain and blood vessels, it can increase your risk for a heart attack or a transient ischemic attack, which is a partial stroke. It can also increase your risk for cognitive impairment. If you have it in your heart, it increases your risk for coronary heart disease, aka heart attack. So what can we do to prevent type 2 diabetes? It is so simple. You just have to lose weight. If you're overweight or obese, you have to start to exercise at least 30 minutes 3 times a day, and you have to make healthy choices with regards to your meals. More protein, more healthy fats, and less carbs. I didn't say no carbs, I said less carbs or starchy meals. How do I know that this works? A study trial was done by 25 to 27 medical centers, and they looked at 3,300 patients. They placed these patients on lifestyle intervention, which is targeted weight loss with exercise and diet changes. in addition to a medication known as metformin, and they studied them from 1996 to 2001. And the results showed that 58% of individuals, of high-risk individuals, were able to delay progression to full-blown diabetes when they were just on lifestyle modifications. And 31% of them were able to prevent or delay full-blown diabetes when they were taking metformin. And that's how we know this is true. You lose 5 to 10% of your body weight if you're overweight or obese. You start a moderate exercise routine, at least 30 minutes. You can do it every day if you have the time, but it's recommended to do 150 minutes a week, and eat healthy foods like fruits, vegetables, whole grains, and low starchy meals. So in summary, there's 6 things I want you to take away from this short, ultra short talk. Prediabetes is a precursor to full-blown diabetes. And it can go into remission with lifestyle interventions, targeted weight loss, dietary changes. If you have full-blown diabetes, you can better control your diabetes with lifestyle interventions in addition to whatever medication your provider has put you on. You need to exercise 30 minutes 3 times weekly. Again, I'm stressing the fact low carb meals to keep your diabetes and prediabetes away. Again, medication adherence, and then ensure that your blood sugar is at target to keep complications away. At this point, I will welcome any questions you have for me.
Thank you for that presentation, Dr. Awusida. Just want to remind everybody, if you have any questions for the doctor, please type them in the chat and we will attempt to present those questions. A couple have popped in, if you don't mind. One is, I have several people in my family who have diabetes. Does that mean I will get it or that I can pass it on to my offspring?
So again, thank you for the question. Actually, it's a really important question. A strong family history of diabetes increases your risks of having diabetes, increases the risks of your children also having diabetes. The way you can gain control back without living in fear is to also look inwards and decide what you want to do. You have to make a choice. Do I want to live with diabetes or live a healthy, full, long life? The only way you can do that is keep an eye on your blood sugars when you go to the doctor and institute the lifestyle changes. So you may not have diabetes right now, but your meals are heavily carb loaded or starch loaded. You snack a lot, you do the wrong things a lot, in quote, living your best life. I would recommend lifestyle changes to keep diabetes away. And the moment you get the diagnosis of prediabetes, it's important for you to just do what your provider asks you to do. Again, I cannot stress the lifestyle interventions enough. So again, it only increases your risk for getting diabetes. It increases your risk, your children's risks for getting diabetes. But when you do everything that I have recommended, it will keep diabetes at bay. And peradventure, you become diabetes, it helps you gain better control of the disease.
Great. I have another question, if you don't mind. Someone asked, I've always been overweight my whole life. Does that mean I will eventually get diabetes?
No, not all overweight people eventually become diabetic. You may not even have prediabetes. It's just one of the risk factors, but it's not 100% for everybody.
Okay, thank you. And one more question, and then we'll move on. Can you explain briefly the difference between getting diabetes at a young age versus getting it later in life? So I guess that question is probably geared towards the little stronger differentiation between type 1 and type 2 diabetes. I think it may be some misunderstanding on where's the cutoff for type 1 and where does type 2 pick up, maybe.
That's a good question. So there's actually no cutoff for type 1 diabetes, okay? Type 1 diabetes occurs from age 0, which is newborns, to 18. But we also have type 1 presenting in the older generation from age 50. We term that latent autoimmune diabetes in the adult. These patients present with diabetes, high blood sugar, they're peeing a lot, they're sick all the time, and we treat the acute phase and we place them on oral therapy. But over weeks, we find out that the oral therapy doesn't control their blood sugar levels at all. And the only thing they respond to is insulin. And so they're technically type 1. Okay, so we have type 1 diagnosed in the young, and then we have type 1, aka LADA, aka latent autoimmune diabetes disease in the adults, in the older generation. Some people mix up having type 1, having type 2, and because your provider puts you only on insulin, you think you're type 1 because you're only on insulin. The problem with type 2 is eventually the cells that are still producing insulin, they eventually are used up, okay? And so at some point, your oral medication may not even work for you anymore because those medications work around your body still being able to produce insulin. And so when it's like using all of the fuel in your car, and then you stop up when you're going up a hill, you're done, your body's done using up all the beta cells that produce insulin in your pancreas. And the only thing that works for you is insulin. So to answer that question, you can get diagnosis of type 1 diabetes in the young, 0 to 18 years of age. You can also get that diagnosis when you're 50, 45 to 50 or older, which is latent autoimmune diabetes in the adult.
Thank you for that information, Dr. Awusanya, and that was an excellent presentation and discussion on diabetes. We thank you for coming today, and thank you for those very informative information of diabetes in our community. Yes, thank you. As we move on to the next presentation, it will be Brother James Brennan Jr. Mr. Brennan will share his journey with prediabetes and diabetes. Brother Brennan works with the U.S. Small Business Administration. He's also served as president of the Panhellenic Council and vice president of Beta Lambda Lambda chapter of Omega Psi Phi Fraternity Incorporated. Brother Brennan, you now have the floor.
Let's see. All right. First off, if we could, let me just say thank you for allowing me to be a part of this, because this is a very informative event. That being said, my last name is Bruin, so let me make sure I get that out there so people know as far as asking. But in all honesty, you know, I was sitting here and I'm listening to the previous presenter, and to be quite frank with you all, I was reliving my own struggle with diabetes. So, you know, I am a type 2 diabetic. And so it is one of those things where, you know, and as I've learned, it's not a quick fix. You know, once you get that diagnosis, it is a daily, I'll say that again, it is a daily one to just have to adjust your lifestyle. So just to share with you all how this all came about, in 2019, I was knocking on 300 pounds with my weight. And so what I did was it was at the early point of 2019, I decided, hey, I got to lose some weight. You know, my ankles were swollen, my feet, and, you know, my friends and fellow frat brothers would notice, you know, when I walked, I would breathe hard, you know, literally would have to stand hunched over. So in taking that initiative to address my weight, and the early part of 2019, I lost weight, which was good. And I was of the mindset that I'm doing the right things. Mind you, as it's already been acknowledged, you know, diabetes is something that happens over a period of time. And so what happened was I went to my doctor in early November 2019, and he shared with me I was pre-diabetic. So what did he do? He prescribed for me metformin. And I was of the mindset, well, that's all I got to do. Take this pill and I'll be all right. Everything is going to come together. So in doing that, I kept eating the starchy foods the lady just acknowledged. I kept drinking my soda, having sweets, you know, just not living as healthy as I should have been. And ultimately, in November of 2019, while driving back home, less than 3 miles from my home, I blacked out. And when I blacked out, I woke up and the police were there. And so what happened was they gave me a DUI test, if you will. And so literally, I just barely was listed as intoxicated, you know. So they went on, they asked me, they saw my pill vial in the car and they said, "Are you diabetic?" I said, "I'm pre-diabetic." So they took me to the jail. When they took me to the jail, they went and they had one of the nurses aides check my blood sugar. And he told me, he said, "Man, your blood sugar is really high. You need to be in the hospital." So ultimately, after I got out, I went on. I said, okay, well, I gotta adjust my lifestyle a little bit more. So I started watching what I was eating better. I started exercising more. And I ultimately went on and fast forward into March 2020. My deuce and my tail, I'm eternally grateful for them because they found me. I was here in my home, right here where I'm sitting, and I was in a diabetic coma. And so I was literally taken to the hospital. You know, my mother, she noticed and she joked, you know, after it was all said and done, I was like that of a John Doe, you know. So ultimately, what happened, and I say this to encourage people, I found out later my blood sugar was over 900. My A1C was 14, over 14. And so that was eye opening. At that moment, that is where I knew, you know, because I was in the hospital for almost a week. I was in the ICU. This was at the onset of the pandemic. So imagine coming out of a coma and you seeing nurses wearing masks and everything. You don't know what's going on. And that was really a scary ordeal. I wouldn't wish that on anybody. And so what happened was I learned while I was in the hospital, you know, because I'm in that hospital bed. I learned how to balance my sugar, watch my meal intake, you know, for the type of meals so I can eat healthier meals, learned about the medication, and also learned how to make sure I check my sugar periodically every day. You know, so what I will say, you know, before I get to a close is that what I would hope everyone get out of this is two things. Number one, absorb this valuable information. Absorb it. I didn't. And I had to learn from that. And I don't want anyone to have to go through what I had to go through. You know, it's scary. You got to think about this because I was off work. I was off, you know, with my health. You know, I'm thankful. I see bros, you know, I was thankful bros was praying and checking on me, but that's not nothing you want to have to go through, you know? And so it's one of those things where as I look forward, and I say look forward because I'm grateful, which is the second thing I'm going to tell you, get checked out, go to your doctor. If you are pre-diabetic, stay pre-diabetic. You know, this is something you have to do every day. You know those numbers. Since I went through and I've been out, you know, I had to have surgery. Like she talked about cataracts, I had to have surgery on both my eyes. I had to have surgery. So you got to think about all that. You know, everything that went on, my health, my weight, I had to have surgery. I went on and was arrested. You know, these are things that could have been avoided if I had just took the opportunity to learn and understand about my numbers. And, that's one of those things, because see, diabetes runs in my family. My mother and my aunt are both diabetics. So we talk about it and we share with each other, valuable information. I love sweets. So I had to literally cut back on what I do as it relates to sweets. I don't eat them as often as I used to. I don't eat bananas and grapes like I used to, because you gotta learn the research to know what is good for you and not good for you. Now, again, let's be real. Bruhs know I enjoy a good cigar. And I'm sure I'm not the only one who doesn't enjoy a good cigar with a good drink. But I know and I make sure I do it in moderation. I don't smoke or drink during the week, because again, you got to be safe. You got to watch your numbers. Just to put this in perspective, we all know rapper Biz Markie. You may not know this. He was a type 2 diabetic. Again, rapper Biz Markie was a type 2 diabetic. So while I don't know exactly what led to him being called home to his glory, I do know that I'm sure with being a type 2 diabetic, that may have played an integral part. So just take an opportunity, watch your health. I got a Fitbit on right now. During this forum, it took away from me getting my walk in. I normally try to focus on getting 10,500 steps every day, Monday through Saturday. And on Sunday, I try to get as many in as possible. I'm going to say this real quick as I go ahead and bring this to a close and answer any questions anyone may ask. My father would ask me, he said, "Hey, man, how do you be getting those great numbers, with walking and everything like that?" I say, "You really want to know?" He said, "Yeah, how do you get them?" I say, "You go in that hospital one time. That's all they take. One time. And trust me, you will want to walk every day. Every day. I walk to live, but more specifically, I live to walk." So that being said, unless brothers, if I may, I will answer any questions you would like me to accept, Brother Pruitt and Brother Jones, but that's my testimony.
Thank you for that very inspiring testimony. I'm sorry, I don't know why I said Brennan.
You good? You good? You good?
I'm just trying
me,
to keep everything going. But thank you for that. Let me see if you have any questions, if you don't mind. You willing
no
to take
problem,
a
brother.
question?
Go right ahead.
Okay. Let me look in the chat here. Thank you for that inspirational story. What would you recommend to someone in a similar situation as your own? So I guess maybe a family member might be asking you, what would you tell another family member to inspire them to kind of get their self together and get their, disease state, take it more seriously is how I'm interpreting the question.
I would encourage you to be real with them.
Okay.
Talk with them, share with them, just real information. Looking back, I saw the signs were there. I just didn't take heed and notice them. So I say that to say we need to make sure we communicate. As we already know, and it's already been mentioned, diabetes runs rampant in the Black community, especially with Black men. I was asked, and if they would like, I will go ahead and be more than happy. Thanks. I see my sister chimed in. She's on here. It's a matter of just being safe and share with that information. I'll give you an example. I do a podcast. A podcast. It's called Bruin Speaks. And I do that podcast every week. I share with everyone who listens on my podcast on Thursdays, 7 to 8, about my health. So they're hearing real numbers from a real person who's dealing with diabetes. I wrote a testimonial, as you are aware. And I shared that with the fraternity, but also I've shared that with other people, even in my own neighborhood. You know, my neighbors see me walking and I've had them tell me, hey man, I see you out there walking, good stuff, losing that weight. I tell them, hey, thank you, but I'm doing this to stay healthy. You know, you got to stay healthy. I mean, this is real. Like I said earlier, you know, I walk to live, but I live to walk. And that's something I don't play about. You know, you got to get it in. It's a daily lifestyle change, brother. I eat salads more now and I drink water, you know, and you have to keep that mindset. And it's something that, you know, if they are pre-diabetic, they need to make sure they stay at pre-diabetic.
Thank you for that. I think I'm seeing a lot of activities. They like that slogan, I live to walk and I walk to live. That's an excellent way to summarize it. As the brother mentioned, we did do an article in the 7th District publication on this brother. And if you would like to get a copy of it, it's very inspirational. That will be available through the Global Health organization, which will give you the information. If you don't mind, brother, we would like to put that out to even more people past the Omega atmosphere and put it out there for even more inspiration to the general public. I'll give information at the end on how you can obtain that article. And excellent, brother. Thank you for that personal touch.
Thank you, brother.
You're welcome. Thank you. Next up we have is our final presenter, which is Miss Betty Walters, Executive Director of Diabetes Coalition of Palm Beach County, Florida. Miss Walters will present us with service organizations like her that offer services to the public. Ms. Walters, you have the floor.
Thank you so much for having me. I mean, I'm just so inspired by the previous presenter, and I'm like, this is what we're all about. We're a nonprofit organization, and our slogan is know your numbers. And as you said, we serve all of Palm Beach County. I just wanted to give you a few statistics. We have 119,000 individuals who have been diagnosed with diabetes in Palm Beach County. There are also, and this is what's critical, another 48,600 individuals who have prediabetes. 9 out of 10 don't know that they have diabetes. So what do we do as an organization? We go out into the community and we provide free diabetes risk assessments, which look at, again, your risk factors. We provide a free A1C. We do lipid panels, look at your cholesterol, your triglycerides, and see what you need. And then we go, and you get these results right there at an event, whether it be at your church, a school, shopping mart. We work in the evenings, we work on the weekends. So we let people know what their numbers are. And if you don't have healthcare coverage, or if somebody needs to be connected to something in the community, we connect you to the community. All of our services are free. We have resources available in Spanish, English, and Creole. And again, I can't stress the numbers enough, especially during this time of COVID. We know that 25% of hospitalizations are people who have diabetes. We also know that 14% of newly diagnosed diabetes happen as they're in the hospital and going through COVID. Now, many of these may already have had diabetes and just didn't know it, but there are others, like the doctor said, who are forming new diabetes. So I cannot stress enough, you've got to know your numbers. We say in our organization, we can't walk a mile in your shoes, but we sure can walk alongside you. And that's what we do. And so I encourage you to look in your own communities to see if they have an organization similar to ours, or if not, go to your clinic, tell them, you know, I'm not sure if I just haven't been feeling well. These are my symptoms. You be an advocate, because you're your own best advocate, and say, hey, I want to have an A1C, or can you test me? I'm just not feeling right. This early intervention saves your life. There is no question about it. And we want to all live a long and prosperous life and just keep on going, especially during this time of COVID. And I just applaud everyone who's been involved in this presentation. I can't thank you enough. And I'm just so honored to have been a part of it. And also, if you have any questions about our coalition, you can go on our website, which is www.diabetescoalitionpbc.org. And you can also reach out to me personally if you want to connect, or if you or your organization or your church, school would like to have an event. And we do educational events as well as screening events. And again, all of this is free. So thank you.
Thank you for those informative information on how people can get in touch with you and utilize the resources that you have available. Thank you once again for coming in and making everything come together at the end for us. As we draw to a close our diabetes education, we thank everybody for coming. I'm Dr. Pruitt again, and I just want to give a few closing remarks before I introduce or reintroduce our 7th District representative one more time for him to do his closing remarks. I want to thank everybody for coming today. Thank you for letting us educate you on diabetes type 1 and 2. Thank you to all the panelists, Dr. Awosanya, the brother's personal testimony, Brother James Bruin, everybody's input today. And I want to thank Brother Sean Bland, who's our technical staff person together. He made sure everything came together. Brother Pratt, Brother Jeffrey Jones, who also was instrumental in putting this all together. And we will have a word now from our district representative, closing remarks, and following him, we will have Shanique Thompson, Miss Intercontinental Jamaica. Brother DR, Brother Reginald Harris, you have the floor.
Thank you again, Dr. Pruitt. On behalf of the 7,000 plus active brothers in the 7th District and over 30,000 worldwide, I just want to say thank you to each and every one of you for tuning in, as well as this collaborative partnership we have with Global Health and Community Service Incorporated. You know, this information is near and dear to me. And what my bio doesn't communicate to you is that I'm a type 2 diabetic as well. As Dr. Awosanya communicated, 88 million Americans are pre-diabetic. And 9 out of 10 of them don't even know their numbers and don't know that they're in this number. For years, I was a pre-diabetic. I began to experience a number of those symptoms that were outlined today. I didn't listen to the warning signs of my body along with those of my primary care physician, and thus today a full-blown type 2 diabetic. I must say, though, that the testimonies that you've heard, as well as the informative presentation on nutrition, has helped me. We hope that it can help you and others lead to detection of the early warning signs and prevention of development of diabetes, just with the simple lifestyle intervention that Dr. Awosanya mentioned. Please take heed in living a healthier life. Know your numbers, or like Dr. Awosanya stated, know your ABCs. Again, my sincere gratitude to each of the panelists in offering your time and talents to uplift our respective communities. Thank you so much. God bless the Omega Psi Phi Fraternity Incorporated and everyone participating today. Thank you.
Thank you so much for joining us on this informative webinar on diabetes type 1 and type 2. And a very special thanks to all of our panelists for sharing a wealth of knowledge. Remember, it is important to be healthy, so please talk with your doctor today about diabetes.